Introduction to permanent makeup. Permanent makeup, also known as cosmetic tattooing or micropigmentation, is a specialized procedure that involves implanting pigment into the upper layers of the skin. This technique is used to enhance facial features such as eyebrows, eyelids, and lips, providing long-lasting cosmetic results. It offers a convenient solution to individuals seeking to save time on daily makeup application, or those with allergies to conventional cosmetics. The process requires precision, artistic skill, and a deep understanding of skin physiology and color theory. Proper training is essential to achieve natural-looking and aesthetically pleasing outcomes for clients. This course will lay the foundational knowledge required for a successful career in this field. Course objectives and scope. This diploma course is meticulously designed to equip students with comprehensive knowledge and practical skills in permanent makeup. We will explore the intricate anatomy of the skin, understanding its various layers and how they interact with pigment implantation. A significant focus will be placed on health and safety protocols, ensuring a sterile environment and preventing cross-contamination. Furthermore, the course delves into advanced techniques, including precise needle selection, optimal needle depth, and the art of color theory. Students will learn to master shading techniques for brows, eyeliner, and lips, creating seamless and natural enhancements. Finally, we will cover essential business aspects such as client consultation and adherence to state regulations, preparing you for a successful and ethical practice. Skin anatomy, epidermis layer. The epidermis is the outermost layer of the skin, acting as the primary barrier against environmental elements and pathogens. It is a stratified squamous epithelium, meaning it consists of multiple layers of flattened cells. This layer is avascular, relying on the dermis for its nutrient supply. The epidermis is primarily composed of keratinocytes, which produce keratin, a protein that provides strength and waterproofing. It also contains melanocytes, responsible for producing melanin, the pigment that determines skin color and protects against UV radiation. During permanent makeup procedures, pigments are ideally deposited within the lower part of the epidermis or the uppermost part of the dermis, ensuring longevity without excessive depth. Understanding the epidermal layer is crucial for achieving optimal pigment retention and avoiding complications. Skin anatomy, dermis and hypodermis. Beneath the epidermis lies the dermis, a thicker layer composed mainly of connective tissue, collagen, and elastin fibers. This layer provides the skin with its strength, elasticity, and flexibility. The dermis houses various structures vital for skin function, including blood vessels, nerve endings, hair follicles, and sweat and sebaceous glands. It plays a critical role in sensation, temperature regulation, and nutrient supply to the epidermis. The hypodermis, or subcutaneous layer, is the deepest layer of the skin, primarily consisting of adipose, fat tissue, and loose connective tissue. This layer insulates the body, stores energy, and acts as a shock absorber. When performing permanent makeup, it is crucial to avoid penetrating too deeply into the dermis or reaching the hypodermis, as this can lead to pigment migration, scarring, and poor retention. Precise needle depth control is paramount for successful and safe procedures. Skin types: oily, dry, combination. Understanding different skin types is fundamental for successful permanent makeup application, as each type reacts uniquely to pigment implantation. Oily skin, characterized by excess sebum production, often presents challenges such as faster pigment fading and a higher risk of pigment migration. Dry skin, lacking sufficient moisture and natural oils, may absorb pigment unevenly and heal with a more patchy appearance. Combination skin exhibits both oily and dry areas, requiring a tailored approach to pigment selection and application technique. For oily skin, lighter, more saturated pigments and shallower implantation may be necessary to prevent blurring. Dry skin often benefits from hydrating pre-treatments and a gentle, consistent implantation technique. Recognizing these characteristics allows artists to adjust their methods for optimal, long-lasting results. Proper client assessment is key to identifying the specific needs of each skin type. Skin types: sensitive and mature. Sensitive skin is prone to redness, irritation, and allergic reactions, making permanent makeup procedures particularly delicate. Clients with sensitive skin require thorough patch testing and a gentle approach, often necessitating hypoallergenic pigments and minimal trauma during implantation. Mature skin, characterized by reduced elasticity, thinner texture, and fine lines, presents its own set of considerations. The skin's reduced collagen and elastin content can affect pigment retention and the crispness of lines. For mature skin, a softer, more diffused application technique is often preferred, avoiding harsh lines that can appear unnatural. Additionally, the healing process may be slower for both sensitive and mature skin types. Careful pre-procedure consultation, detailed aftercare instructions, and a conservative approach are vital to ensure comfort, safety, and beautiful results for these clients. Adapting techniques to these specific skin types ensures client satisfaction and minimizes potential complications. Health and safety. Sterilization. Sterilization is the cornerstone of health and safety in permanent makeup, ensuring the complete elimination of all microbial life, including spores. This critical process prevents the transmission of infections and protects both the client and the artist. All instruments that come into contact with skin or bodily fluids must be sterile, including needles, needle cartridges, and certain machine components. Autoclaves are the gold standard for sterilizing reusable tools, using a high-pressure steam to achieve sterility. Disposable, single-use items, such as needle cartridges, gloves, and pigment caps, are equally vital in maintaining a sterile environment. Proper handling and disposal of these items are also essential to prevent contamination. Adhering strictly to sterilization protocols is not just a best practice, it is a legal and ethical imperative in the permanent makeup industry. This commitment to sterility builds client trust and upholds professional standards. Health and safety. Cross-contamination. Preventing cross-contamination is paramount in permanent makeup to safeguard against the spread of bacteria, viruses, and fungi. This involves implementing strict protocols to avoid transferring pathogens from one surface or client to another. Key practices include using single-use, disposable items for every client, such as needles, pigment cups, and cotton swabs. Artists must wear fresh gloves for each procedure and change them if they touch non-sterile surfaces. All work surfaces must be thoroughly disinfected before and after each client using hospital-grade disinfectants. Proper waste disposal, particularly of sharps, is also crucial to prevent accidental punctures and contamination. Establishing a clear, clean, and dirty zone helps maintain organization and minimize risks. Consistent adherence to these protocols ensures a safe environment for both the practitioner and the client, upholding the highest standards of professional practice and client care. Health and safety. Client screening. Thorough client screening is an indispensable step in ensuring the safety and suitability of permanent makeup procedures. This involves a detailed consultation to assess the client's medical history, current health status, and any potential contraindications. Artists must inquire about allergies, medications, skin conditions, and previous cosmetic procedures. Conditions such as pregnancy, breastfeeding, certain autoimmune diseases, blood thinners, or active skin infections can preclude a client from receiving permanent makeup. A patch test is also crucial to check for allergic reactions to pigments or numbing agents. Open and honest communication during this phase builds trust and allows the artist to make informed decisions regarding the client's eligibility. Prioritizing client safety through comprehensive screening not only protects the client, but also safeguards the artist's professional reputation and legal standing. This proactive approach minimizes risks and ensures positive outcomes. Needle types, liners, and shaders. The selection of the correct needle type is paramount for achieving desired permanent makeup effects. Liner needles, typically consisting of a single needle or a tightly grouped configuration of a few needles, are designed for creating crisp, fine lines. They are ideal for outlining brows, defining lash lines for eyeliner, and creating precise lip borders. The tight grouping allows for concentrated pigment implantation, resulting in sharp and distinct strokes. Shader needles, conversely, feature a looser grouping of needles, often in a round or flat configuration. These needles are engineered for depositing pigment over larger areas, creating soft, diffused effects and building color saturation. They are perfect for powdered brows, lip blushing, and soft eyeliner effects. Understanding the distinct characteristics and applications of liner and shader needles is crucial for mastering various permanent makeup techniques. Proper needle choice directly impacts the quality and natural appearance of the final result.